Joining me now is Boston Mayor Marty Walsh. Mr. Mayor, thank you very much for taking the time out to join us. Let me first get a real quick update on that number. Do you have an update as to how many, has that number changed? How many healthcare workers have been infected in the Boston area?
No, you have the most accurate numbers, and a little later today we'll have more numbers to update. The numbers usually come out 3 or 4 o'clock by the State Department of Public Health.
Give us a quick sense of where things stand right now in Boston, generally across the general public. Where do you expect to be by the end of this week?
I mean, our numbers have increasingly gone up in the last 4 days. I think we went from 80 to 87 to 113 to 121 yesterday. So we're seeing this rise. I think that as the week goes on, we're going to see our numbers even continually going up more. Some people are even suggesting they might double by the end of the week, meaning double digits every day. So we're still very much in the beginning of this fight, I think, in trying to prevent the spread of the virus. As more tests become available, obviously more people are going to test positive, and I think that that's something that we have to continue to push back and make sure that people are practicing social and physical distancing and making sure that people are staying in and around their home. The governor came down with a stay-at-home advisory here in Massachusetts, which includes Boston. A lot of people are adhering to that, but there's still too many people that just aren't adhering to that.
I know that Boston hospitals are facing the same shortage of critical equipment as others around the country. What more do your hospitals need, and where are you turning for assistance on that? Are you having a hard time acquiring the same equipment, whether it be masks, PPEs, or ventilators, that the rest of the country is having a hard time acquiring?
No, we are, and I think it's not just our hospitals, it's also our frontline first responders. Last night I was on a conference call with the U.S. Conference of Mayors, and we took some action in sending a letter to Washington trying to break this logjam to make sure that we get our equipment down to our cities and towns. This week is really a critical week for a lot of places that, any supplies that people might have had, that they're dwindling or they're gone. And I think this week is going to be key. We've been told this week the equipment's coming and we're going to have it, or at least the masks and gowns and gloves and things like that. We can't just keep hearing promises. That has to happen, because we want to make sure that we protect our frontline workers.
So what would you be doing right now to be better prepared, but you can't without the outside support? I mean, if you kind of look back at this right now, were there anything you would do differently, either as a city or as a mayor, to have been better prepared for this moment?
Well, I think, first of all, none of us, I don't think there's any mayor or governor in the country or really prepared to deal with a worldwide pandemic. And I think the fact that we're going through this now, we're obviously going to, for the next generations of people that have to deal with it, we're going to have a playbook for them. And I think that really the sense of urgency is today. And I think that the top-down approach as far as getting equipment is the way, the system that we have in front of us. And Washington and the federal government just needs to start getting this information down. Just like they worked on the stimulus package. They worked pretty quickly on the stimulus package, and they got it done, and the president signed it. And that's $2 trillion that's going to help our small businesses and unemployed workers and things like that. And that was fairly quick to do that, and with almost unanimous support. When it comes to the equipment and the medical equipment, the fact that we're lagging right now for such a major country and the best country in the world really says a lot about that on a national level. We weren't prepared for this. No, we weren't prepared for anything like this. And this equipment needs to get down. I mean, it's as a mayor of Boston, and I think I can speak for other mayors and town managers across the Commonwealth and governors, the governor of Massachusetts and across the country. I mean, that's what our workers need right now. And our frontline workers are going towards the virus to address and help people that are sick, but we are not supporting them enough by getting the equipment to them, and that has to change.
Yeah, Massachusetts has a statewide stay-at-home order in effect until April 7th. You've said that you expect this to go on a lot longer. Can you help viewers understand why, if people are largely staying home and social distancing for several weeks, that your sense is it might take months to get through this?
Well, I think that we're going to take a longer time. Everyone keeps putting dates and moving them down the road a little bit here. And I think that I would rather be prepared for a longer term stay at home than give people false expectations. And I think that people need to understand the seriousness of this, and they do. Clearly, there's no question about it. But I think that, once we get over the kind of the peak here, or the curve that everyone keeps talking about, if we don't stay disciplined and continue to social distance and physical distance distance and stay kind of in our own family units, what we'll see is a second peak. And what we need to do, and I'm not an expert in this, but experts, I've listened to enough of them and hear them, and I'm taking their advice very seriously. That's how we stay on top of it. I was talking to a family member in Ireland yesterday, and they were telling me that, they took the warning from Italy really seriously, and they basically shut the country down. And that's what we have to do. We have to basically shut the country down. And that doesn't mean an order has to come from the White House, or it doesn't have to come from governors. We're telling people need to understand this is serious, and you can, by practicing social isolation, by practicing physical distancing, you can do our part, and we can do it ourselves.
Thank you for checking out our YouTube channel. Why don't you subscribe? It's really easy. Just click on that button down there. And for more news from MSNBC, click on any of these videos here for the latest interviews and highlights. You can get more videos from MSNBC with our newsletters. Head over to msnbc.com/newsletters to sign up.